The treatment of diabetes contains two components actually, non-pharmacological treatment and pharmacological treatment. Non-pharmacological treatment is common for both type 1 diabetes, type 2 diabetes or any other kind of diabetes, whereas pharmacological management of diabetes differs in between type 1 and type 2 diabetes. Coming to non-pharmacological treatment of diabetes, all these four things are very much important. One thing is diet, what you eat, how much you eat, at what time you eat is very much important to control your blood sugars in all kinds of diabetes. The second important thing is the physical activity. How good is your physical activity in a 24-hour day span also impacts your blood sugar and blood sugar control. And the third important thing is the quantity and quality of sleep. Having a sleep of uninterrupted sleep of 7 to 8 hours at night is essential for any diabetic patients to have an optimal blood sugar control. That's why we see in a nocturnal shift patients we see a higher blood sugars, requirement of higher dosage of medications or insulin in nocturnal shift patients. And the fourth important thing is the stress management. The stress can be any infection in your body or allergy or mental stress. These stress can cause excess cortisol values or growth hormone values and cause impaired blood sugar in the patients. So we have to address their diet, physical activity status, sleep and stress management, and all these contribute to the non-pharmacological management of diabetes. Coming to pharmacological treatment of diabetes, in type 1 diabetes, as I said, the insulin production is nil, so they have to be on insulin. No other medication can control the blood sugars in type 1 diabetes. And again, type 1 diabetes has to take their insulin shots, and insulin is varied. The types of insulin are ultra fast acting insulin, fast acting insulin, short acting insulin, long acting insulin, and again ultra long acting insulin. We have to give a combination of insulins to control their blood sugars in type 1 diabetes. They have to take their shots at least 3 to 4 times in a day to control their blood sugars. Coming to pharmacological management of type 2 diabetes, we have many classes of drugs that can control the blood sugars. Some drugs can control the blood sugar and cause weight loss. Some drugs can control the blood sugars and cause weight gain. So if your patient is obese, we try to give a drug which can cause weight loss and blood sugar control. And all the newer medications for diabetes are very much safe for the type 2 diabetics. They can control the blood sugars and they have a very low chance of hypoglycemia, that is low blood sugars.